Folks, I'm Dr. Fazil. You are watching Dr. Fazil's show, May 2024 edition. Today I'm going to talk about a very important issue. The issue is having blood in the urine. So sometimes we call it hematuria. What the blood in the urine means that either you can see it, it's so bad that you can see it, it's like a reddish in color, or sometimes your provider will tell you, hey, you got blood in the urine. Because when they do a dipstick analysis of the urine, they will find blood in the urine. So that's important. It's like a smoke, and if you have a smoke, you need to find fire. So you do not have blood in the urine, normally speaking, no protein or no blood. If you start to show up those features in your diagnostic testing, for whatever reason it was done, then obviously you cannot just ignore it. Oh, we'll keep an eye on it situation. No, you need to, the provider have to find out the source, because that could be early symptom of a lot of pathology. Now, the blood in the urine can come from the urinary bladder. You can see a picture on the back. As a matter of fact, I'm going to bring a hologram for you. Right here, you can see there's a urinary system, there's a urinary bladder, and then in men they have prostate, and then female is just the bladder and going to urethra, and then there's ureters, and there's the kidneys right here. So the blood has to come. So let's have this hologram go on the side. So blood in the urine has to come from one of those structures. Let's say common causes. For example, it's coming from how would you know if it's from the kidneys or from urinary bladder, right? From the kidneys, generally you will have another blood test. For example, in your labs, in the laboratory tests, you will have, for example, abnormal kidney function. So if you have abnormal kidney function, obviously that can cause blood in the urine, but you will link it back to your low kidney function, right? And generally they also have protein in the urine as well. So if you have a low protein, protein in the urine, some blood, kidney function may be normal, maybe low, and other risk factors, then we can focus mostly on the kidneys. Then it will, obviously you need to see a kidney specialist. They can do diagnostic, take a picture of the kidney. For example, kidney stone can cause blood in the urine or inflammation in the kidney, and there are dozens of different kinds. So generally speaking, if it's inflammation of the kidney, for example, IgA nephropathy or minimal chain disease, there are different kinds. I'm just giving you some examples. That can cause some leakiness of the blood. The blood is supposed to stay in the blood and not in the urine. So kidneys filter the blood and take away the urine as a waste product, and everything else, including blood, stays in the blood vessels. But if they start to leak, then obviously we have a problem, right? So we need to find out if there's inflammation in the kidney. A tumor on the kidney can also cause benign or cancerous tumor in the kidney can also start to spill blood in the urine. Stone in the kidney can also cause it. There's some genetic other causes of the blood in the urine. So then, as a further diagnostics are done, then the provider can find out and then treat it appropriately.
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
The other source of the blood in the urine is the urinary bladder. So if you have normal kidney function, if you have no protein in the urine, just the blood, it could be microscopic, like only on the dipstick, the provider is seeing it. Then further evaluation need to be done. For example, stone in the urinary bladder, inflammation of the bladder, we call it cystitis, or in urinary tract infection can also cause some blood in the urine. But then you will have some pus in the urine as well, right? That would be seen on the dipstick. And then very important cause is urinary bladder cancer. So I have diagnosed many patients with either prostate cancer in the men or bladder cancer, both in men and female, way early before it got spread. So what you do, you confirm it, then you have have them see the urologist, which is a medical side of urinary system. They do a scope known as cystoscopy. You can see on my backside on the picture, see how the procedure is done, the urologist look with the camera inside the bladder. If there's any mass, they take a biopsy. If it's a cancer, then they obviously send you to appropriate specialists. So folks, if you have blood in the urine, don't ignore it. That's not something you want to let it go, because again, this is like a smoke. And before the smoke, and this is always the fire, so you want to find it early, way early. So if there's any fire, we can put it off before it causes major damage. For example, in this case, like if there's inflammation in the kidney, we don't want to wait till it destroys the kidney and you end up on dialysis. Or if it is a tumor, you don't want to miss it, because with a tumor, you might want to get it early, taken out early, or fix it early before it can spread to the other body parts and become difficult to treat. Same thing is urinary bladder or prostate cancer. If there's an issue, that need to be appropriately investigated and then taken care of. So again, minor things, please don't ignore it. Among the minor things, blood in the urine was the most important cause. As most people, they cannot see it, providers sometimes ignore it, or they overlook it. But if there's a blood in the urine, even a 1 drop, even 1+, we call it 1+, or microscopic hematuria or blood in the urine, that's a warning sign. So folks, do take care of that. On that note, it was Dr. Fazil's show. With the topic of discussion was for May 2024 was for hematuria is a medical term. Layman term would be blood in the urine. Could come from the kidneys, bladder, or both. On that note, folks, I will call it a day. Till the next time, we'll bring you the most important and interesting topic for your medical education, so you can stay healthy and live longer. Thank you so much for watching Dr. Fazil TV show.